Hi, good afternoon. So, my name is Evelyn, your nurse for the day. I'm here to talk to you about tetralogy of Fallot, in short, TOF. This condition or this disorder is when the patient with combination of four birth abnormality, they have a health, meaning they have health problems, and is a congenital health heart condition that is present from the birth. Together with these four abnormalities, influence the blood flow through the heart and then the lungs. These four abnormalities of the heart are ventricular spectral defects. That is when there is a big hole between the left and the right ventricle, and that permits the blood that is the bad or the blue or the low oxygen blood or the poor oxygen blood to flow into the left ventricle. The second one is the right ventricular hypertrophy. The cardiac is where the cardiac muscles around the right ventricle is enlarged. We have the third one. This is the aortic override of the spectral defect. That is when at a point at which the poor oxygen blood or the oxygen poor blood enters, which is the blue one I said in the beginning, enters into the bloodstream or the systemic circulation. And then the last one is the pulmonary stenosis. That is where blood flow to the lungs may be restricted. It can go due to the obstruction of the right ventricular output. So there are certain signs and symptoms the baby could be experiencing. That could be cyanosis around the lips and then the nail bed, curving of the fingers and then the toes, trouble feeding, inability to gain weight or to grow, or abnormal development. These are some of the few signs and symptoms, and it is very important to take these signs and symptoms very seriously and get medical help as soon as possible, because this will help the provider to focus on the child and then to treat them with something like the oxygen, the IV fluids, relaxing the infant. Maybe sometimes the patient may be hyper, so relaxing them too can also help. Administration drugs, which would depend, and then the most important thing is surgical correction. That is where they have a procedure where they operate on the baby, and this when survey has made us understand, or statistically, the first year of the baby's life, there has been 95 babies with the tetralogy of Fallot being successful when they undergo through this surgery. Even though the heart rate slows down after the surgery because of the heart block. But then this heart block can bring the damage of the inflammation of the heart conducting the system. However, the patients gets better, and then their regular rhythm resumes, so meaning they get better. And then some of the signs and the side effects of the medications could be rashes, diarrhea, upset stomach. Sometimes even they can be resistant to the medication we giving them. And then that's basically some of the signs, the side effects of those medication. However, I want you to keep in mind that it's very critical to adhere to advice of the caregiver professional or to keep all appointments. Very important, because frequent checks up and then enhances the child's quality of life and then assist managing the symptoms of the TOF, tetralogy of Fallot. So I think, yeah, that is basically that for now. Do you have any question for me, or maybe should you want me to explain something further which you didn't really catch it? No? Okay. All right. Thank you then. So yeah, I'm going to get your uh, medication for you soon. Okay. Thank you so much. All right. Bye bye.